I'm going to welcome everyone here in the space. My name is Taylor, and I'm the Executive Director at the UCLA Pritzker Center. And before we begin, I want to thank All for Kids for providing Spanish translation today. My colleague Nancy is going to make an announcement.
Thank you, Taylor. Hola, buenas tardes. Para todas las personas que gusten interpretación en español, por favor pueden encontrarme a mí o a mi colega Loida. Muchas gracias. Sí, y bueno, vamos a estar en la esquina, allá en la mesa de atrás, o por si gustan interpretación en español otra vez. Mi nombre es Nancy y allá les ayudamos con mi compañera Loida.
Thank you so much, and once again, a big thank you to All for Kids for supporting our Spanish translation today. On behalf of our faculty, staff, and students, we are pleased to host you today. It is a joy to reconnect with many friends and partners and to make so many new friends here in the Antelope Valley. For a few housekeeping items, the bathrooms are located here to my right. There are refreshments on the tables, and more will be served throughout our networking session outside. We also have drinks here. Please help yourself. Please note we are recording this event and taking photos throughout the afternoon. Please notify myself, Christine, or our student Mia if you have any questions or concerns about that. We also want to thank Jalisco and Hector and Nacho for hosting us today. Let's all give them a round of applause. And a special thank you to Hector's amazing team supporting all of the food preparations today. We're so grateful to Jalisco for welcoming us to this beautiful space. Let's take a moment to meet your table mates if you haven't already. Please connect with each person around your table. Tell them where you're from, what brought you to the event today, and anything else you'd like to share. We'll take a few minutes to do that now. please see my colleague Norma. Norma's going to wave. She will help you place them out on the table. Thank you to those of you who brought items to share. And for those of you who are interested, there is a resource table here, which you're welcome to peruse. All right, turning to some background and our goals for today. The UCLA Pritzker Center was established in 2018 at UCLA. Do we have any Bruins in the house? All right, excellent, go Bruins. We are grateful to the Anthony Pritzker Family Foundation for its long-standing support and to the Ralph N. Parsons Foundation for sponsoring today's event. UCLA is a California public university with a deep commitment to community engagement. At the UCLA Pritzker Center, we are an extension of this mission. We dedicate our work to advancing child welfare system reform through multidisciplinary collaboration on campus and across LA County. We wholeheartedly embrace the Antelope Valley as a prominent, unique part of LA County. Our work here in the Antelope Valley since 2019 would not have been possible without the vision of Dr. Shannon Tyne. Is she here? Not yet? Much love to Dr. Tyne, she'll be here shortly. And the long-standing dedication from Dr. Lisa Gantz, who you'll hear from shortly. We are also thankful to the many partners who have supported and welcomed our work in this community since 2019, who we will hear from shortly. And yet, as time has passed, the needs of the community have changed. And this is what brings us here today. We are genuinely curious. Where does UCLA fit in now? How can we help? What research ideas can we support? And as we do this work in partnership, hand in hand, how can we do it better? How can we center the community and its needs in all that we do? As we share more about what we do today, we hope it inspires you to think about what we could do next together. Thank you so much for joining us, and I'd now like to welcome our incredible student, Valeria, who's going to share more with you about today's activities.
Hi everyone. My name is Valeria. I graduated from UCLA last year. I'm currently a research assistant at the UCLA Pritzker Center, and I plan to pursue a master's degree in social work. I am a proud resident of the Antelope Valley. I have lived here with my family for 20 years in Little Rock. And today I will offer our land acknowledgement and tell you a bit more about what you can expect during our time together. As a land-grant institution, UCLA acknowledges its presence on the traditional, ancestral, and unceded territory of the Gabrielino Tongva peoples. Today, in the Antelope Valley, we honor and pay our respects to the elders, past and present, and to descendants of the Fernandeño Tataviam Band of Mission Indians, the Serrano Yahaviatam, or Ma Ring Ayam, and the Tongva peoples. For our agenda today, we will start with a presentation outlining current and past collaboration in the Antelope Valley, share a landscape assessment, outlining the disparities, progress, and opportunities pertaining to child welfare, invite discussion and feedback from the group, participate in a community polling activity, and engage in networking and resource sharing. Thank you all for coming today. I am proud to call everyone in this room a neighbor and friend. I look forward to working with you today. And I am now pleased to introduce Dr. Brenda Tully. Dr. Tully is one of our research directors at the UCLA Pritzker Center.
Good afternoon. Thank you, Valeria. All right, so thanks everyone for joining us today. We're really happy to be here. I imagine that alert is kind of around the room. As Taylor mentioned, and as some of you know, we've been working in the Antelope Valley since 2019. I'm joined today by 4 of our tremendous colleagues and collaborators, Dr. Lisa Gantz, Mia Mesa, Lisa Whitecrow, and Sarah Perry, who will share more about our collaborative work momentarily. will be Dr. Lisa Gantz and Mia Mesa. They will share about our Avenue project. Dr. Lisa Gantz is board certified in pediatrics and internal medicine and currently provides care for children and adults through the LA County Department of Health Services at High Desert Regional Health Center and Olive View UCLA Medical Center. At UCLA, she serves as the UCLA Pritzker Center Child Health and Wellbeing Fellow, while also serving as an assistant clinical professor. She collaborates with DHS, the UCLA Center of Excellence, and the UCLA Pritzker Center on trauma-informed, community-based initiatives in the Antelope Valley region. Mia Mesa graduated from UCLA in 2024, earning a Bachelor's of Nursing with a minor in Chicana and Central American Studies. A longtime resident of the Antelope Valley, Mia is now a registered nurse in the emergency department at the Antelope Valley Medical Center. Mia has also served as a research assistant at the UCLA Pritzker Center since 2021. Mia combines her experiences from UCLA and the hospital to provide quality and accessible trauma-informed care to all patients and their families. I welcome Lisa Gantz, Dr. Lisa Gantz, and Mia Mesa.
Hi everyone. Good afternoon, and thank you so much for joining us today. It is an honor to be here on behalf of the Pritzker Foundation and on behalf of the LA County Department of Health Services, or DHS. I see lots of familiar faces in the room. This is a very tight-knit community, and it's been my honor and my privilege to work with a lot of you over the last 6 years since I started my career as a physician after graduating from UCLA. I was born and raised in Canyon Country, not too far down the hill from here, but have become an honorary member of the Antelope Valley. My heart really lives with this community, and I serve here, and am honored to be a part of it. I work as a primary care doctor here at the LA County Department of Health Services at High Desert Regional Health Center. Our clinic serves, with its sister clinic, over 10,000 children. We are the largest pediatric healthcare provider in the Antelope Valley, and in the broader context of LA County DHS, we serve more children at our 2 clinics up here than almost all of the other pediatric sites combined down below. We have a large population, and as everyone here probably knows, and I see in my daily clinical practice, this community faces some unique challenges. Our geography places us over the hill from many of the resources and programs serving most of the rest of LA County. Although there's been significant population growth here, and many efforts to keep up with that from our committed community leaders, some of the needed infrastructure, funding, and crucial family-facing resources still are struggling to keep up with the pace of our growing needs. But as everyone else here also probably knows, this community is incredibly tight-knit, resilient, and creative. Recognizing these 2 realities, we began our work in the Antelope Valley to seek to better understand community needs and understand existing community collaborations and efforts. The UCLA Pritzker Center has been central to catalyzing efforts to help our team at DHS to develop stronger and more effective partnerships with our incredible community partners and sister agencies. In 2020, we launched an effort called Avenue, the Antelope Valley Engagement Network United for Equity, with the goal to expand access to trauma-informed care and resources in the AV through education, integration, and partnership with and for our community. This work has taken on many forms. We provide resources and technical assistance to existing community collaboratives, such as our partnership with the Antelope Valley Health Neighborhood Meetings, run by one of our incredible sister agencies, Department of Mental Health. Our Avenue team also helps raise community awareness of local resources by helping AVHN to compile their newsletters. We have also fostered partnerships with UCLA to meet community needs in creative ways. In partnership with DMH, DHS, and UCLA, in 2020, in recognition of the growing crisis of pediatric mental health services up here, we launched the Antelope Valley UCLA Public Partnership Program, also known as AV UP, which utilizes an integrated behavioral health model to provide mental health services to children in the AV. AV Up has helped bring critical mental health services to hundreds of DHS patients during a time of overwhelming demand in the wake of the COVID pandemic. Avenue has also sponsored continued education, including a community spotlight series to raise awareness among our DHS staff of our incredible community partners, and compiling an asset map of community resources and programs on One Degree, a free online platform that allows our clinic to share resources with children and families and refer our patients to social services. Our Avenue student leaders from UCLA, some of whom grew up here in AV, helped propel all of these efforts forward. I am thrilled to pass the mic along to Mia, one of our incredible former students, to share more.
Thank you, Dr. Gans. Hello, everybody. My name is Mia Mesa. As an early example of our efforts in the Antelope Valley, we partnered with Los Angeles County Departments of Health Services and Public Health to increase access to healthy foods. With these partnerships, we hosted once-monthly, no-cost fresh food distributions serving hundreds of families each month. We have also unpacked and given out tens of thousands of diapers from baby to baby. Our Avenue team also supports the Day of Giving and community-based events hosted by partners such as Antelope Valley Community College. These events really allow us to share our work, share resources with the community, and most importantly, listen to the needs of the community. In doing so, our team heard directly from the community about the challenges they face and based on a daily basis, which led to the formation of our research efforts. The Antelope Valley Needs Assessment came from our team's desire to find peer-reviewed research that described the challenges we were seeing in our community. We learned that at the time we conducted the needs assessment in the year of 2023, that the Antelope Valley semi-rural classification left it ineligible for many rural development and health funding programs, despite facing challenges similar to rural communities, contributing to the overlooked health and social needs. Additionally, significant neighborhood disparities existed in the Antelope Valley, with higher neighborhood deprivation index scores concentrated in communities of color, reflecting systemic inequities in employment, education, housing, and justice systems. Economic hardship was widespread in the AV, with nearly 24% of residents living below the poverty line, unemployment around 17%, rising housing costs, increasing homelessness, and 16% of renter households experiencing rent burden. Families in the Antelope Valley face major unmet basic needs, including high rates of food insecurity and inadequate child care access, forcing many caregivers to either leave work early or completely leave the workforce entirely. Research on adverse childhood experiences, also known as ACEs, in the Antelope Valley highlighted the long-term health impacts of trauma, including links to chronic diseases, mental health conditions, and domestic violence, while ongoing community partnerships aim to use ACEs data to guide prevention and policy efforts. Some of you may have actually seen this assessment, which we presented to social services agencies and community coalitions, including all of you, High Desert Regional Medical Center, and Work Connection. While findings were in some ways disheartening, we heard from the community members that the lived experiences of this group and community were affirmed by our assessment. And by sharing our findings, we hope to inform future research and policy efforts to address the unique challenges faced by our community, the Antelope Valley. The needs assessment also informed subsequent work we did in partnership with DCFS and Valley Oasis. To share more, I am now pleased to introduce Lisa Whitecrow, DCFS Deputy Director for Service Bureau 3, which includes both Palmdale and Lancaster DCFS offices, and Sarah Perry, the Chief Executive Officer to Valley Oasis.
Good afternoon, everyone. Nice to see so many faces. My name is Lisa Whitecrow. As introduced, I'm the Deputy Director for DCFS for Service Bureau 3, which is Palmdale, Lancaster, and Santa Clarita.
Good afternoon. My name is Sarah Perry. I'm the Chief Executive Officer for Valley Oasis.
Thank you. The Los Angeles County Department of Family, DCFS, also known as the Los Angeles County Department of Children and Family Services, operates one of the nation's largest child welfare systems, where domestic violence is a common factor affecting families. Research has shown that poverty, racism, and gender inequities shape which families come to our attention, and the child welfare system as a whole, and how they are treated once involved. In 2020, the UCLA Pritzker Center partnered with stakeholders across Los Angeles County to examine how domestic violence intersects with child welfare involvement. That work identified several key challenges: limited understanding among child welfare workers about the dynamics and trauma of domestic violence, insufficient collaboration with domestic violence specialists, and policy barriers that often increase family separation instead of supporting safe, stability, and reunification. In response, UCLA launched a pilot partnership in 2023 with Valley Oasis and the DCFS Lancaster Regional Office to better understand survivor experiences and test collaborative interventions in the Antelope Valley.
So this study found that parent survivors face significant barriers when navigating child welfare cases. Many are coping with complex trauma, financial instability, housing insecurity, transportation challenges, limited childcare, long wait lists for services. Survivors often struggle to leave abusive relationships safely, and once the child welfare becomes involved, they're frequently expected to manage complex systems with little support. The study evaluated 2 interventions led by Valley Oasis: advanced domestic violence training for DCFS staff and ongoing domestic violence consultation. Both improved staff knowledge and helped workers apply trauma-informed, survivor-centered approaches in their practice.
Overall, the findings point to the need for stronger collaboration between child welfare agencies and domestic violence service providers, continued efforts to address systemic racism, and expanded economic and housing support for survivors seeking safety and stability for themselves and their children.
This work also inspired AB 779, a bill authored by local Assembly member Tom Lackey. The bill creates further opportunities for experiment with pilot efforts like ours across California.
And I just want to say, I know that I speak on behalf of Sarah and Valley Oasis and the DCFS Lancaster office that we felt, I don't know, where's Taylor? Oh, she went outside, okay. Well, I just want to say to Taylor and to Brenda and the research team that we had the privilege of meeting so many years ago, how very lucky we felt to be able to participate, to open up our offices and our staff to collaborate and build something that we believe can really champion the way that child welfare agencies and the child welfare system in general works with partnered agencies to support our families in the Antelope Valley. So thank you for that.
Thank you, Lisa and Sarah. The pleasure was ours as well. So thank you. All right, so the work that we do, partnership is essential to what we do and how we do it. And so we really, thank folks who've spoken so far about that partnership and what that looks like. The partnership has also inspired us to prepare a new brief, which Nia mentioned an earlier brief that we had done. My colleagues from the UCLA Pritzker Center, Dr. Ivy Zukaya and Patrocinio Cruz, will review the brief next. Dr. Zukaya is my colleague, the other research director at the Pritzker Center, and Patrocinio is a graduate student in both the MSW and the Masters in Public Policy program at the UCLA Luskin School of Public Affairs, and he's also a graduate fellow with the UCLA Pritzker Center. So welcome.
Thank you so much for being here. So you heard earlier from Mia that there was a needs assessment done, and it's been a few years since then, so we launched into this effort to kind of get some updates on that. I'm just going to direct folks to, on your tables, there's a copy of the brief of this. It's also available in PDF form on our
website, but if you're like me and like a paper copy, feel free to take it with you on your way out. If you don't get a copy, come see me. We're happy to find one for you. So really, the purpose of this landscape assessment was to bring together publicly available data on LA County's child welfare, healthcare, education, and socioeconomic systems to try and offer a cross-system look at outcomes, assess disparities, track progress, and then identify opportunities for future systems reform work in the Antelope Valley. Want to shout out the Anthony Pritzker Family Foundation for its ongoing support of our work out here, and the Ralph M. Parsons Foundation for supporting this work specifically. So just want to acknowledge that this, what you're about to see is sort of some key highlights on data from these different systems, starting with the child welfare system and performance in the AV. We drew heavily from these other reports that were created, so we just want to acknowledge and thank all of the departments and all of the community members that contributed to the data that we were able to draw from.
In working in this landscape analysis, first we wanted to understand the geography of the Antelope Valley. So for those in the room that are just getting to know the region, what is often referred to as the Service Planning Area, or SPA 1, is an isolated region of the northern LA County that includes many sub-communities listed here. These include urban cities, rural and semi-rural communities, and sparsely populated desert areas. For many families from the overpopulated metro Los Angeles area, the AV promises a more spacious and affordable lifestyle. At the same time, the remoteness creates its own challenges. Residents are hit harder by hazardous weather-related events than in other parts of the county. Between 2020 and between the 2000 and 2020, the Antelope Valley experienced a 40% growth in its overall population. The Black community in the AV grew significantly. Many families relocated from Central and South LA, and today the region is home to about 430,000 people, about 5% of LA County residents. The Antelope Valley has a higher proportion in children than any other region in LA County. There's a lot of kids out here, like a lot. Roughly 120,000, over 1 in 4 AV residents is under the age of 18. And 1/4 are children under the age of 5. More than half of the AV children are Latin, 1 in 4 are white, and 1 in 7 are black. About 4% are Asian, and less than 5% are Native American, Native Hawaiian, Pacific Islander, Southwest Asian, or North African. Compared to the county as a whole, fewer Antelope Valley residents immigrated to the U.S.
So starting with the child welfare system, which really is the central focus of our work as a research center, following the 2014 child maltreatment fatality of Gabriel Fernandez, who was an 8-year-old from the Antelope Valley, the Los Angeles County Blue Ribbon Commission on Child Protection conducted a sweeping review of our system and released an extensive set of recommendations for transforming the county's prevention and intervention systems of care for children and their families. So that's kind of our starting point for this, what we looked at. And as Lisa mentioned, the AV is serviced by 2 DCFS offices, one Palmdale, one Lancaster. And this area really became a microcosm for the county's system change efforts overall. Right? One major child welfare reform goal is to improve assessments of safety and risk
with the ultimate goal of reducing unnecessary system involvement, and then also making sure that when children do come into the system, that they move through it, right, in a timely way with successful outcomes. And so just in terms of background context, historically, the rates of involvement in the child welfare system out here across a lot of the different gateways, meaning CPS reporting, substantiations, foster care entries, and then overall counts of children in care have been significantly higher in the Antelope Valley. So that's a longitudinal trend that we've seen. And now Pat is going to share a bit with you about some of the post-pandemic data and what we see.
The figures on the screen present post-pandemic rates of CPS reporting. And so if you kind of look, the top, it represents Lancaster, the green represents Palmdale, and then the bottom represents LA. And so they represent the post-pandemic rates of CPS reporting and investigations at the Lancaster and Palmdale offices, along with LA County as a whole for comparison. CPS reporting and foster care entries dropped sharply during the pandemic everywhere, but returned to similar levels in the 2 years that followed. Since 2022, rates of child protection system reporting and investigations have declined steadily across the Antelope Valley, but remain high when compared to LA County as a whole. Rates are notably higher in Lancaster versus Palmdale. The next two graphs show foster care entry rates and confirmed maltreatment rates between 2021 and 2025. Substantial and entries into foster care have gone down since 2022. Basically, fewer AV children are making it into the front door of the child welfare system than in years prior. At the same time, more of the AV child populations became involved in the child welfare system than LA County's child population. And little change in these disparities has occurred since the pandemic. And so you can kind of see that although rates still have gone down, they're still larger when compared to LA County, which is representative of the orange line on the bottom.
So overrepresentation of Black children in the foster care system has really been a focal concern with recent system reform efforts in the Antelope Valley specifically, and then Los Angeles County as a whole. So what these two graphs show you are disaggregated rates by primary race ethnicity of children for our foster care entries, so coming into placement. And really what we see is progress has been made to reduce disparate foster care entries for Black children relative to white and Latino children in this region. The rate steadily dropped from 2023 to 2025 in Lancaster, and we saw that it did plateau a bit after 2024 in the Palmdale, cases served in the Palmdale office. It's important to note that disparate child welfare involvement is also a pressing issue among Indigenous communities. So entry rate data like this for Native American and Indigenous children is not publicly available at the regional office level. So that's why it's not being presented to you today as well. We recognize that's a limitation. But we will say that countywide, we know foster care rates have steadily declined for Indigenous children over the same time period. Now, as Lisa kind of alluded to, there's quite a few of these child welfare performance metrics that we use to assess how the system is performing and how they're balancing a really complex combination of child welfare or child safety, stability, permanency, and well-being. And so these can be helpful to understand where progress has been made. When we look at those higher level outcomes, sometimes it's not quite clear the nuances. So these help help us understand a little bit under the hood of why we might be seeing what we're seeing. And so what you can see here, these are 5, but non-exhaustive, 5 key performance areas. And so comparing data from the 2 regional offices, we can see some notable differences in system performance. Specifically, the Palmdale office was outperforming LA County at keeping children safe while in the system and ensuring that they exited quickly. At the same time, children re-entered foster care within 1 year of exiting at slightly higher rates than were observed countywide. Compared with countywide rates and the Palmdale regional cases, we see that the Lancaster DCFS office did see longer permanency timelines and higher rates of maltreatment when children were in foster care, but we did see lower re-entries in that way. So we're going to be asking folks at the end of this for your feedback. So take notes, write down your questions, because there's going to be follow-up discussion, do you buy it, what's missing? So I just want to plant that seed, okay, as we move through this. We know that the child welfare system does not function in a vacuum, right? It is very dependent and has to interact with all of the other service systems. And so we know that just looking at these in isolation doesn't give us a full picture of what's going on for children and families in the region. And as the system shrinks in a way, right, fewer children are formally coming in, that also means that we're looking more and more to the other social service and family serving systems to make sure that they have their needs met. So the following sections highlight some key indicators of these other systems' performance.
So this is a quote from the Measure of America, and it reads, "A lot of families move here and migrate here hoping for a better experience. A better opportunity because the housing apparently at this point is more affordable than anywhere else. However, there are many challenges once those families are up here. There's a lack of transportation, there's a lack of children providers, and extracurricular activities for kids. And if there is those opportunities, they're not accessible for everybody." This is from an Antelope Valley resident, and it's in the midst of collecting all this data, it's really nice to also hear some of the voice from some of the Antelope Valley residents and see how they perceive it. And so, financial hardship remains a pervasive and increasing challenge for families in the AV and has sweeping impacts on child well-being and development. Compared with LA County, families in the region spend a comparable share of income on housing, but have less money remaining for children, transportation, basic needs, and other expenses. As a result, over half of children in the region live below 200% of the federal poverty line, which is more than 10% points higher than the county's average. The lack of local well-being employed opportunities leads many AV residents to commute long distances or exit the workforce entirely. By 2023, the AV had the lowest employment rate in the county. Car ownership is less common, and commute times are considerably longer among Antelope Valley residents than in the metropolitan LA area. So when looking at these two maps, I want you to take safety net into account, right? And so adults receiving the social and emotional support they need, it's essentially a survey that was given to adults, and the lighter area represents them reporting less support, right? And so if you notice that in SPA 1, adults in this SPA reported not being able to receive the social and emotional support they need. On the map to the right, children whose caregivers report difficulty finding needed childcare, there was also high reports of that in SPA 1. And so when you put those two things together, it kind of shows you that parents, adults in the AV don't feel like they have that safety net. Right? And then that leads to other things. And so these two maps kind of give us a picture of the safety net that the adults or the parents in the AV feel. And then relative to families across LA County, more children and parents from the AV face unemployment, poverty, and food insecurity. Barriers to financial stability for parents include local and sustainable employment opportunities near where people live, reliable, efficient transportation, trustworthy, accessible, and affordable childcare, social and emotional support for parents, which is foundation to caring for children.
All right. So when we next we'll look at the healthcare system and some key indicators there. So one hard to swallow reality is that the average life expectancy at birth for babies who are born in the AV is about 5 to 7 years shorter than the county average. And we will just note that when this is actually broken down even further to some of the specific communities within the AV, that varies quite a bit from place to place. We know that from birth there's some health disparities that really set children up for hardship, right? And make it hard on birthing parents as well. And in particular, we see a lot of disproportionate infant mortality, low birth weight, preterm birth, and some of these high rates of developmental delays being diagnosed for children that are born here. And just want to note that we do see those disparities for Black birthing parents out here as well. We know that significant investments have been made and are, in this moment, being made to address some of that disparity. And so, we're dependent on the data that's currently publicly available, but we're really excited as numbers come out to see how some of those efforts really may have made some transformation. So we'll hit you with another map. Access to quality, timely healthcare is essential to child well-being and minimizing detrimental effects of adverse childhood experiences. Child health insurance rates out here are really good. They're really high. And in terms of specialized health diagnoses for the child population, overall, you've got a really healthy child population. At the same time, though, challenges to accessing routine and preventive health care, including mental health care, is a big challenge that does have health consequences despite kind of that baseline health. And so comparing LA County with SPA 1, we see SPA 1 actually contains most of the county's medically underserved areas, and really this is attributed to shortages of primary care, mental health, dental care professionals. But we will say that more recent survey data has actually shown that in recent years, caregivers and parents are reporting a little bit more ease in accessing pediatric health care. Didn't report any change for parents accessing medical and mental health care, which we're a little bit concerned about, given that that feeling that they're not receiving the emotional and social support that they need, and the fact that has actually increased over time since 2015. So we do still need to think about healthcare and preventive healthcare for parents. I'm going to give one quick example of sort of where we see the lack of preventive or routine healthcare, how that can actually have some real consequences on the health system and health outcomes. So the map right here shows that relative to other parts of the county, very few children here are diagnosed with asthma. We know we've got beautiful landscapes, the sun's out, the fresh air out here is real different from Metro LA. But due to these barriers to accessing preventive care, we actually see some of the highest rates in the country of children relying on emergency medicine to treat asthma. Right? So that's a concern, and we also know that in terms of just costs on the healthcare system, there's real consequences there. So in terms of just some key takeaways, right, the health and developmental disparities in the AV begin at birth, and they really are exacerbated by that limited access to preventive medical and mental health care. And we also really acknowledge that there have been investments in this area over the last few years, and unfortunately, in particular with the life expectancy and some of those things, the COVID-19 pandemic really did hinder some of the efforts to improve these outcomes.
So something that I want to reference is, Ivy was referencing developmental delays. And so when you look at these two maps, the first one on the left represents the percentage of children enrolled in preschool. And again, SPA 1, which is the lighter shaded one, represents the highest percentage, or one of the highest percentages for not having children enrolled in preschool. The map on the right is percentage of third graders meeting California literacy standards. And again, SPA 1 represents not having met those standards, right? And so one of the things that we're trying to kind of create a picture around is like, how do all of these collaborate with each other, right? And how can we offer support on different sectors to be able to help with the developmental delays that we're seeing appear. So high quality early child education programs can help families address developmental delays and support children's transition to primary school settings. Preschool enrollment for children ages 3 to 4 is notably lower in the Antelope Valley than in LA County overall, revealing a missed opportunity for children that may benefit from early educational programming. So when looking at the educational system, during 2021-2022 school year, high rate to suspension led to considerable loss of instruction time with Black students enduring half of that loss. Then when you look at the graduation rates, LA County's graduation rates for that same school year, 2021-2022, stood at 86%, while the overall graduation rate for the AV stood at 67%. This dropped significantly for unhoused students and for students who spent time in foster care. Only 1 in 5 Antelope Valley residents go on to earn a bachelor's degree or higher by the age of 25 compared to 1 in 3 Los Angeles County residents. So it kind of all ties in, right? Like when you kind of look at what one does to the other. And so some key takeaways are that academic milestone data suggests that the AV school districts and education professionals are not sufficiently resourced to meet the educational needs of the region's growing and changing student body. Learning loss and fear resulting from suspension and law enforcement involvement make it challenging for students to feel safe in schools, prioritize learning, or perform academically.
So over the last decade, we know there have been considerable efforts by many of the folks in the room to address some of the disparate outcomes here in the Antelope Valley relative to LA County as a whole and some of those other regions. These were made possible by community-driven advocacy, innovative cross-system partnership, and public-private partnership. We hope today that that can continue, and some of why we sort of did your assigned seating was in the hopes that there would be more cross-system relationship building, and hopefully that will develop into some fruitful partnership. County leadership in particular has prioritized expanding the region's health and human services workforce, increasing workforce development training for folks who are on staff, and then increasing employment supports and opportunities from the education system into the workforce, particularly for immersion adults. Yeah, we just really want to recognize that there have been so many efforts out here to address some of these things, and we know that system change work takes time, right? We don't expect to see the next year data show dramatic changes, but we hope that it is helpful to see where progress has been made and you're able to track that, and where maybe we're not seeing that yet. And so that leads me into our future directions. Hopefully this helps illuminate some opportunities to improve child and family well-being in the region. Some of these that we identified, but we'd like to hear more from you folks, are successfully connecting families with high-quality preventive medicine and mental health assessments and treatment if it's needed, ensuring access to paid family leave and quality childcare. We recognize that not all families want to put their child in childcare, right? But given the financial precarity, exiting the workforce is also a really risky move for families out here, and so finding that balance. Resourcing schools and offering developmentally appropriate support early on, particularly for those children who are being flagged for developmental delays. And then strengthening community-based family preservation, reunification, and aftercare services, again in the hopes of reducing unnecessary child welfare system involvement. And then on the research side, we really see examining the effectiveness of interventions within the Antelope Valley will be helpful, and tracking and monitoring progress toward the goals and ultimately toward ensuring child safety and well-being. So I'm going to turn it, thank you so much for listening and wading through some data with us. We know that not everyone loves to look at graphs as much as we do, but we hope that it's helpful. If the slide deck would be helpful to anyone's organization, come find us. We'd be happy to share it in other venues. You also have the brief, so feel free to use that however it's helpful. And I'm going to turn it over to Dr. Tully again to start getting the conversation started so that we can actually hear from you now.
Okay, thank you, Dr. Zukaya and Patrocinio. Thank you to our partners who you heard from earlier today. Now we'd like to get all of you involved in the conversation. We invite you to talk with folks at your tables. We have some questions that are posed here, and we have a paper for you to take notes on. So what we'd like to do is, as we go about exploring how the UCLA Pritzker Center can be supportive of the Antelope Valley, we're curious about what stood out to you from the landscape assessment, what was missing from your perspective and your vantage point, what ties in with your work, and maybe what misses the mark. And then we know, as Dr. Zukaya mentioned, there's a lot being done here already, and we also know that there's still work that needs to happen. And so what information, evidence, or documentation would be helpful to inform your work here in the Antelope Valley so that we can see progress moving forward, and what programs, what services, what interventions are working, and what need to be adjusted or adapted so that they work better. So those are our questions. So right now, I'm going to ask that one person from each table, and for the tables up here that have more people, you can divide into two with 6 people and 6 people, just for ease of conversation. We'll ask folks to identify one note taker, or 2 if you want. There are 2 pages for notes. So if you could take a moment to do that. Who would like to be the note taker? This does not mean you have to talk. This means that you're taking some notes. All right, so we love the conversation that's happening, and we really look forward to gathering your notes when we finish our debrief here. So I want to let folks know, if you want a copy of the brief, we do have copies. Feel free to raise your hand. You can also scan the QR code on the table, which will get you to an electronic copy of the brief. So thank you for that. The brief is on our website, and that's where the QR code takes you to. So thank you. All right. So as those copies go out, I would love to just open up the conversation and let's talk about what you talked about. So in terms of what stood out to you and what you felt was missing, I'd love to hear from some folks about that. And I'm gonna do a teacherly thing. And I have a colleague here, Jimmy Guevara, who was a student of mine at USC. So I wanted to invite Jimmy to kind of share some reflections on their conversation about what stood out and what was missing. Jimmy, I'm going to bring you the mic, even though I know you can project.
Thank you so much. I appreciate that introduction. I did not expect that. All right, now, so what we talked about in our table more than anything else was like what stood out and what was missing, right? I think one of the things that we were talking about, like the percentage of graduation rate in high school and the access to transportation to those schools. I think those were the percentages or data we would like to see. Also breaking it down to what district has the biggest challenge, who has more resources versus less, just call it like it being straightforward. The other thing that kind of stood out was the high percentage of foster children placement with relative to living in EAB. The other one is growing population, but no change in resources, waiting for services, a list of services. Other thing that was missing was what did waitlist mean and for what, I guess. So that one I'm a little confused, but okay, I'll take it as it is. What ties into, so those are some of the things that we were talking about, especially with the access to education. I know that was one of the things that and then also kind of seeing like how even within CBOs and even within the county like services as a whole, we're not communicating effectively enough, and I feel like we're not sharing. So sometimes these grants come out, we're also competing against each other. I think that was one of the biggest things that we really were addressing, which is unfortunate because like they were mentioning earlier, was maybe this CBO has a grant, then the next CBO, and so forth and so forth and so forth. Now we're no longer communicating for the fact that we may lose the grant or for whatever reason or another. So those are one of the biggest things that we were really discussing as a whole. So hopefully I covered everything, ladies. That's about it. Thank you.
He's a very good student and a great professional. We ran into each other today, so it's really nice. So a couple of things that Jimmy and his group discussed really stand out to me. That sort of siloed nature of the work that happens sometimes means that families they might know about one, resource, but not about the others. And sometimes as we're practicing in our area, we may not know about all the resources. And I know as we prepared for this event, one of the things we did is really kind of dive into, what work is happening and who's doing it. And we saw that there were a number of organizations that were more newly offering services here in Antelope Valley. So we're happy to have folks here. And so what does it mean when families have to wait? I think we can open up that conversation if other folks have talked about it. And I'd love to hear from some other folks about, what stood out, what's missing, how did some of the landscape information that you received tie in with your work? Maybe some of it seemed to conflict. What did that look like? And then we'll continue the conversation. If you have ideas about where research or evaluation, data collection, information would be helpful for moving the work forward and the well-being of children and families, we'd like to hear about that too. So who else would like to speak? We had a number of people who, everyone was super engaged, so thanks, Brenda.
So at our table, we talked about how remarkable it was, the huge population of kids up here, and especially in comparison to the rest of LA. We also talked about, the glaring mismatch between the amount of services and the resources that are available and the population size. And as we were thinking about, what data or research could we if I could wave a magic wand and say, poof, I want this. If there was a way for us to show, with UCLA's help, how much dollar per dollar is being invested in our kids here, and how glaring the gaps are in how much is being invested in kids here versus anywhere else in LA County, and is there a way that we could show what the return on investment would be for them if they routed that funding into childcare, but that it really can't just be isolated to one area because all of these different things are intersected, and funding childcare but not funding transportation to get to it doesn't help anyone. And is there a way that we can systematically show what we know is the reality, that there isn't enough funding for the size of population to try to get at that root cause, but also most of us don't understand who makes those decisions and how those policy dollars work their way down. So guidance on how to actually get it where it needs to go to move the money.
Yeah, thank you for that. When Lisa Whitecrow and Sarah Perry were speaking earlier, Sarah mentioned SB 779, which encourages counties to connect their child welfare organization with domestic violence service organizations throughout the state. That bill was passed, but it doesn't have funding attached to it. So it kind of speaks to your point there, right? So getting at the policy pieces that connect with the money, the resources, funneled to the right places is really important. Okay.
So our group, we had similar themes that Dr. Young's talked about. Just what stood out most was just there's so many children 0 to 5 in this community, and the transportation was just a huge issue. Also that services don't match the population, and medical providers, we need more in this community. Other topics were immigrant communities are hesitant to get the services that they need. Regional center was missing in the conversation, so and what their role in the community is. We need more big boots on the ground for specialized services. Also, we have more transportation issues here. Childcare, the timed early and late childcare issues, so making sure for working parents that are traveling so far away, so not, they have long commutes. And the school districts need to be more involved and not so siloed in all of these conversations.
Thank you very much. The transportation piece is something that has come up in pretty much all the conversations that we've had here, with parents, survivors of domestic violence we've spoken with, spoke exactly to this point. And, if there are not reliable public transportation to get from point A to point B, it makes it really hard to both take care of your child, get to work, get to the services that you need, and kind of just do life. So that transportation issue continues to come up, so thank you for that. I was wondering, could you speak a little bit to the mismatch between the services and people? Do you have an example or two that you might give for that?
I think we just talked about that more services are needed just around this area. So services such as childcare, services such as regional center services and access to regional center services. We had a discussion about how hard it is to get regional center services, or at least to get not on the regional center's part, but just like how do you get to that point as a parent?
consistently. So they're like, why am I going to keep reiterating my story to all these different people and you're just gonna leave? With the relatability, you don't look like me, you don't know what I go through, you're not gonna understand what I'm going through, so why am I gonna talk to you? That's a major area.
I agree with you, Terry. And along those lines, also Spanish services. I mean, that's just one that we saw in the presentation. In this community is over 50% Hispanic, so we need more representation and services for the populations.
Yeah, thank you so much. You're touching on the workforce turnover, and that's speaking to, it's hard. When you have staff who turn over, obviously that affects the families who are engaging in services, and it makes it harder to kind of stick it out and feel like, you're getting what you need from that place when you're having to re-explain kind of why you're there and what you're looking for. So that, I know, has been an investment, but I hear you that that's an ongoing barrier as well. How about a few other folks? Okay, I'm gonna go up here, so the upper level.
So piggybacking on pretty much everything that was already said, a couple of things that we discussed also was housing rates, right? The unhoused families that we have here in Antelope Valley. And second, workforce development. So many of our families travel down to LA for better rate, for better paying jobs. We need that here in Antelope Valley as well.
Thank you, nice smile. Right here. Oh, okay, we're gonna take one more on this, and then we're gonna move to question number 3. Oh, you can.
I'm Shannon, and I'm representing our lovely table here. I'm actually from the school district, so I'm from the East Side Unit School District. So ditto to kind of everything that's already been said. So one of the things we talked about was the quality of service here in the AP. We talked about, retention and the mental health professionals that are working with our youth. We talked about oftentimes we, get people that may be starting out in their program, working towards licensure for MMT, LCSW. What they do, they may come to Antelope Valley because there's openings, they may work 2 years, get that experience, and they're off to higher paying jobs. Or they're, going to another area. Same thing's happening in the school district. You may get a newer teacher, they'll come, get a little experience, and then they're off to Hart, to Saugus, to, the Santa Clarita area. So we talked about appropriate, compensation, and even kind of doing some research on what's the typical number of years of service for our different providers and teachers here in the AV. How long are they actually staying? Where are they coming from? And then when they exit, where are they going? How many are actually staying and being invested here in the community? Another, transportation, I can't say that enough, with my school district being the East Side Union School District. If anybody's been on the East Side, some of the areas don't even have sidewalks. There are no bus stops at all that stops near any of my schools. There's one at East Side High School, and then the next one is all the way at Lancaster Baptist. I know you guys may not be familiar with those areas, but the people in the room are. So that's continuing to be an issue. Back to what you said about the regional center being in the room and being a part of the conversation. We've seen increasing numbers grow in our SPED population, specifically in my district. Last year, we had about 14% of our population was SPED. This year, it's grown to 20%. So that's a 6% increase in just one school year. So when you talk about drowning and having to hire additional sites and additional speed, so it's we can't keep up. And then, we talk about people that are moving up here from the AV, all the new housing tracts that's being built everywhere. Every year, each of our schools, we're getting more and more impacted. We're getting more kids, and they're coming in with needs that we can't meet. I have parents that are telling me, I moved up here because it's cheaper, but I actually have to move back down to LA because you guys don't have enough services to meet the need for my child. So think about what that does to a family. I can't afford LA, so I moved to the AV, but you guys can't meet my needs, and I need my child to be well, so I actually have to move back down, and maybe I have to be doubled up with a family member because I can't afford to live in LA. So these are some of the stories that we're hearing from our families. Yeah, you guys tell a lot of those. Also, opportunities for our youth. I know we said that number was alarming to me too. Like a lot of our youth a lot of the people here in the AV are under the age of 18, and then looking at our graduation rate. So what are the alternative programs that we're bringing to the AV? If they're not graduating, if they're not, going to college, that percentage, what are those apprenticeship programs? What are those electrician programs? What are the different things that we're offering our youth? So it's just not, you don't graduate, you don't go to college, and you're just, stuck just getting an ordinary job.
Took us there to this next question, which is perfect. I would love to hear from some other folks about, what information, evidence, or documentation would be helpful to inform your work here in the AV. This idea of, who's coming to work here, how long do they stay, and where do they go after is great. Like that information could really inform kind of, what's happening, and then what retention strategies could be developed and that kind of thing. Each of the issues that I hear folks talking about touch families who are involved in the child welfare and foster care systems as well. And so, you add that layer, and our work focuses in that area. And we think about, what does it mean when a child is in a foster home here, but their birth family is in Metro LA? What does transportation mean for visits and things like that? So I would love to hear a little bit more about ideas for information that would be helpful as you continue to move your work forward, and particularly related to the child welfare or foster care would be great, but in general would be helpful. We'll take a couple more comments. Okay, we have folks up here. Perfect. Thank you so much.
Greetings everyone, my name is Mommy London. I am the CEO of Serenity Village Developments, and our solution is resource hubbing. Have you all heard of resource hubbing? Yes. Right? There is no place in the Antelope Valley that carries all of our resources. Who's been here a long time and remembers the Red Book? That was a grad, right? Red Book books? It was a grad school project that someone put together to gather all of the resources in the Antelope Valley in one location. So that's some of the work that we're doing as a solution. What is here? We talked about the new services. When they get here, Chamber of Commerce folks, County Board of Chamber. When somebody comes here, the cities know who's a new business, right? So they have a list and they send it out to everybody. Oh, if you're a member of the chamber, here's the new business. We would like to create that for resources. When there's a new resource, you know about a new resource, and you tell her, and then she calls me, and we put it on the list, right? DMH is doing a resource list right now. Hubbing resources in one location, just one. And there's no proprietary, it's like, oh, Mommy is hubbing resources, it's hers. Absolutely not, right? Everybody can access them online, one location, everything that's here, every program, every workforce development. We were talking about trade schools, like just one AV hub of resources.
Hi everyone, Kamal Jones, pediatrician and the interim medical director at our High Desert Health Clinic for kids in foster care and child welfare system. A couple of things that we talked about, obviously things that many of you already touched on, but in terms of information, we really wanted to see some more detail about who are the kids who are repeatedly getting involved in the foster care system. What are their backgrounds? What's the family's financial situation, race, ethnicity, things of that nature? Where are places that we might be able to intervene? Similarly, we were talking about CSEC and gang involvement and some of the disparities that we're seeing there, and it'd be interesting and helpful to have some data around that. And just as was touched on, there's so many people in this room who are doing such fantastic work. What are some bright spots? What are some places that we can really build off and just copy, paste, obviously make tweaks for our individual families and patients, but how can we learn from each other a little bit more? Those are some of the main things that stood out for us.
involved in the child welfare system repeatedly, and how do we support them comprehensively so that they have an opportunity to access the support they need that works for them, right? That's helpful. And then the hubbing, I love that. That is huge. All right. So I think we will shift gears. I'm going to ask Valeria and Mia if you could just, as they walk around, if you could hand them your note sheet, that would be great. We will be taking your notes and compiling them into another post-convening brief. And also I want to mention that you're at the comments of your table, maybe think about convening those opportunities to learn from each other as a resource to the community. That's great, thank you. Okay, so Valeria and Mia are making their way around to pick up notes. Thank you for that. We are going to do another activity, but I want to just point out that as you're moving about the room, we do have resources on the table over here, so please feel free to take those and share them with the families you're serving. We have agua frescas here. We will have food outside, so that's coming momentarily. So please take advantage of that. And then we also have products from Baby to Baby here outside as well. So I'm going to turn it back over to Ivy, who is going to introduce our next circulating activity.
Hello again, everyone. So we are nearing the end. We have one more activity to get you up out of your chairs and also kind of transition us so that you can get some food, check out the Baby to Baby. Feel free to come back in here with your food, or stay on Air Network if you have a jacket on. But to wrap us up, we're going to introduce our last activity. So most of you are familiar with the issues that make it challenging for families to thrive without child welfare involvement and leads to outcomes. Yes. Sorry about that. I need to channel the patrocinio. So you'll see that we have a number of topics or issues or concerns that are listed around the room, right? So these are areas that do fall within the wheelhouse of what we study as a center. And these are areas where the available data and other research have really pointed to as driving some of the disparities, driving some of the challenges with repeat system involvement, or having trouble exiting successfully for families. So we want to hear from you. This is a place where you really get to essentially vote. Everyone is going to have access to some dot stickers, and what we invite you to do is let us know which ones you find most pressing. You know, if we get a grant tomorrow to do work out in the AV, what do you want us to focus on? And so you're going to get, I believe, 10 stickers per person. Feel free to throw 10 stickers on your number one priority if you really want to do it that way, or spread them out, whatever you want. So the time and the items are here too. If you want to stew on them for a minute and kind of think about it, feel free to head outside, go get food, and come back in. We just ask that